que sienta la dicha que habita en lo amado, y que sienta la dicha de un día de sol, y que sienta la dicha que habita en lo amado, y que sienta la dicha de enfrentarse a estos tiempos con conciencia que en ellos habita la infinita posibilidad de crear lo sublime y lo bello y entregarse a estos tiempos aún conscientes del miedo y abrazar la infinita posibilidad de vivir lo sublime y lo bello. De crear lo sublime. El alma, el cuerpo, los huesos y el corazón. Que sienta la dicha que habita en lo amado y que sienta la dicha de un día de sol.
Tu nostalgia recuerda el comienzo de un árbol que toca el cielo.
Y que sienta.
All right, good morning, good afternoon, good evening, wherever you are joining us for this event today. My name is Lily Pell Baba Otu. I'm from Ghana, and I will be moderating this event. I'll be co-moderating actually with Daniel. So before Daniel comes in to introduce himself to a few housekeeping rules, please let's kindly turn off our phones or anything that would distract us from being attentive to this meeting. Let's mute our microphones until we have something to say, then we can unmute and share so that we don't get any feedback. So I'm a journalist and I'm a gender advocate. I'm also a digital marketer as well. And you're all welcome. We are very excited to have you join us today. So at this point, I think Daniel will introduce himself.
Good morning, everyone. Thank you so much, Lily Bo, for kicking it off. I'm Daniel Krakow. I'm a youth advocate and expert from Rio de Janeiro, Brazil, and I had the pleasure to be collaborating with this incredible report on the Unequal Pandemic. And I'm so pleased to be here with all of you and such amazing panelists from across the globe. We are here today on the sidelines of the UN High-Level Political Forum to launch the Unequal Pandemic report. The report uses data and insight from communities and civil society organizations to uncover the inequities of the COVID-19 pandemic and spotlight communities' response and resilience. A link to the report is going to be available in the chat. We hope this event sparks a global dialogue on collaboration and data and fighting inequities and discrimination and injustice. And we want you to be part of this conversation. So please take your time to write down in the chat your reflections and questions for the panelists through the Zoom chat box and join the conversation on Twitter by using the hashtag Unequal Pandemic. Lily Po, back to you.
Thanks, Daniel. We have an exciting agenda today, and we'll hear from leaders from communities, from governments and civil societies. And our speakers join us from Burundi to Bangladesh to Ecuador to Kenya. So first of all, we'd like to begin by sharing our own reflections on the unequal pandemic. So in Ghana here, the reflections I had was to always have a side business, which gives you access to the internet as well, because when the pandemic hit, everything else had to do with the internet. But the problem about this internet issue is that not many people have access to the internet. So people who are living from hand to mouth, who do not have access to basic amenities, this became a huge challenge for them. There are women who had to go back to their abusive husbands and partners and stay with them because they became their only source of income. So this opened my eye to the fact that a pandemic has happened does not mean it is just the pandemic that is affecting people. People are being affected I will hand over to Daniel here to also share his own reflections on the inequalities of the COVID-19 pandemic.
Thank you so much, Lilipo, for your insights and perspectives that are so valuable on how this pandemic had disproportionate impact in several communities across the globe. And here in Brazil, I'm from Rio de Janeiro favelas. When the COVID-19 started to hit us, youth from favelas was the first one to respond. We created collaborative spaces to protect and stand up for our communities. There, we could share accurate information on how to prevent people from getting the virus, to also mobilize donations of food baskets, hygiene supplies, and protection materials. And despite of our digital divide and lack of education access, as young leaders, we are not data science experts, but that didn't matter. We knew that by getting closer to our community, listening to their demands, tracking the increase of cases, the shortage of food and supplies in our own local territories and communities, we could provide a better responses and be able to use our networks and our capacity to mobilize people as a powerful response to the pandemic. When institutional, as governments and international organizations didn't have the times and resources to support us. And in these conversations, we can give a step forward in creating and better future into sustainable rebuild. But then, first of all, as we did in Brazil in this report also, we need to first understand how this pandemic impacted different communities and our needs for the future. And we can only do so if you have access to quality data, data that's intersectional, data that values and validates local knowledge. We need to strengthen the partnership between the civil society organizations and national data authorities and also international organizations. And we need to start a conversation how to design, strengthen a more accountable data mechanism for analysis and implementation in the creations of public policies to overcome the COVID-19 impact and create better realities of inclusion and sustainable development. So it's pretty much that from my side, Lilipo.
All right. So Lilipo here, we'll now hear from two community advocates who have contributed to the report and who bring their own lived experiences and activism to this topic. And I'm delighted to introduce Suleiman. He is a deaf disability rights activist from Abuja in Nigeria. He is also a national project officer, organizations of persons with disabilities engagement inclusion works at African Disability Forum. Suleiman, you can take over now to give us your responses on the impact of the COVID-19 pandemic.
Okay, thank you, Lily Pearl. Okay, as you said, my name is Suleiman Abdulmumuni Uja. I am on a light brown kaftan with an embroidered design with a brown cap, and my background is white. Truly, the effect of the pandemic on persons with disability in Nigeria and that globally cannot be overemphasized, as it's left a lot untold hardship on the group, unlike those without disability. Imagine from access to service, healthcare service delivery, for example, everyday needs, going to the market for shopping for domestic needs, support for persons with disabilities at home. Most important is COVID-19 information flow. Oftentimes you talk on radio, deaf persons cannot hear, there is no interpreter. Even when they are on television, interpreters are not available. And some places, they make announcements, but there will be no electricity supply for them. And the effect of this has created a barrier for persons with disability that still exist, and no disability inclusive data disaggregation. Secondly, the importance of that report, if you look at my first explanation on the effects, this report will go a long way in cross-checking the gaps and remove the barriers, while also addressing the best disability inclusive data disaggregation for various stakeholders and governments in their policy, planning, and implementation. These documents will ensure active involvement of persons with disability in their representative organization, in the policy formulation from the beginning of the process and the decision-making stage. For this to achieve the laudable objective of a global slogan that says, leave no one behind, through full inclusion as far as the issue of COVID-19 and beyond are concerned. Please refer to Article 31 of the UNCRPD with respect to government to make sure all persons with disability are accountable. Very important, as it's the key responsibility of the government to involve persons with disability in the process. And then, for me, one important thing that we all need to know, to take away, is that there are a lot of useful documents that we must look at why all stakeholders and governments should use disability disaggregated data to create evidence-based program and policies, and implementing them for the full inclusion of persons with disabilities in all COVID-19 intervention programs and beyond. It is very important. You have to recognize the link. The link will be shared through the chat box. Thank you very much.
Okay, thank you very much for such powerful comments, Suleiman. I'm also, I understand everything you're saying and I side with you. I'm pleased to introduce Vapu at this moment, a campaigner for the rights of older persons in Finland and globally. Vapu, if you're on standby, you can take over.
And I also would like to thank for the opportunity to speak here and to thank Suleiman as well. So I'm coming from Finland, far north, although we have a very hot summer here. And for the Nordic countries, we have managed quite well with the COVID. But my point, what I would like to make is that Here in the Nordic countries, people mostly live alone. They do not live with their families. We live alone. And this is a trend all over the world. It's coming everywhere. When people here mostly live alone, they are enclosed in their small apartments with no visitors and no contact with people, even with the grandchildren. And we have been protected from the virus, but the virus of being alone, I think, may be proved to be much more of a killing nature. I know that UN organizations have started to talk about the shadow pandemic, and they mean the increase in domestic violence when people are closed in their families. But there is this other, even darker shadow that is not being yet addressed. We older people being starved of human contact, no one hugging us, no one touching us, no one close us. And there, civil society organizations have a very important role to play. And we know how to help people there. And it's important to collect this data as well. I dare say that I do know how important accurate age disaggregated data is for decision making and for understanding people's living conditions and needs. Because I have been active in politics as a Minister of Health. I have been active in research as a professor. I have been working in administration as a Director General, and all my life in NGO sector, in all possible roles there, grassroots and leading. And I think that NGOs are close, ordinary people, everyday life, that we know how people live, how they feel and what they need. And what we know is that we older people, we are not heard. We do not have a real voice. Even this month, I was interviewed for an opinion poll on coffee drinking, can you imagine? When I asked what is the upper age limit for interviews, it was 80 years. I'm 81. I did not qualify. How did I feel? And who are drinking more coffee in my country than older people just? Crazy. So we need age disaggregated data. But until now, we have to collect it by ourselves. It's important, it's very significant and worthwhile. I have been in a delegation to Statistics Finland to ask why they don't collect disaggregated data. And what do they say? It's costly and it's not demanded. Hey, we have to pressure our decision makers. We have to convince them to see closer us and to think better. That's why we need. Thank you.
Okay, I think I muted myself. Thank you so much, Vapu. Thank you for your thoughtful comments and strong call to action. Please do share any questions for Vapu and Suleiman through the chat box, and we'll come to them later. So at this juncture, I'll pass over to Danielle to begin our panel discussion.
Thank you so much, Lily Pell, Suleiman, and Vapu for such an inspiring and strong start of the session. Oh my God, it was so powerful. Thank you so much for sharing that with us. We will now have a discussion with some excellent speakers. I will introduce them as I ask them the first questions, and we will then have time for the audience Q&A. And as we have a lot to get through, I respectfully ask the speakers to keep their comments up to 3 minutes or less. The first one is Mohammed. Welcome you. Mohammed is the Interim Executive Director of the Disabled Peoples International, the DPI, the co-representative of the stakeholder group for persons with disabilities, and the Senior Advisor for G3ICT. Mohammed, we have heard from Suleiman that the unequal impact of the pandemics on persons with disabilities. And globally, we also saw how quickly and robustly the global community pushed back and advocate for persons with disabilities. I would love to hear how important was data to your advocacy work during the pandemic. Mohammed, the floor is yours.
Thank you very much, Dan. Thank you, everyone. Thank you for the organizers to having us at this important panel. That's not the first time we work together. It's always great to be with you. To answer your question, Daniel, I would like to say that it is essential to collect COVID-19 data on persons with disabilities, because persons with disabilities have been one of the groups most adversely impacted by the pandemic and consequently left behind even more. Moreover, most governments have not been collecting COVID-19 data on persons with disabilities. To address this gap and find answers, organizations of persons with disabilities took action and carried out community-driven data collection. One example is from the stakeholder group of persons with disabilities that carried out 2 phases of qualitative research to learn about the experiences of persons with disabilities in the context of the COVID-19 pandemic. The first phase of research took place in 2020 with global disability movement leaders, and the second phase built on this in 2021, exploring the experience of persons with disabilities in 3 countries, Bangladesh, Bolivia, and Nigeria. The research provided compelling evidence that most persons with disabilities around the world have been adversely affected by the pandemic, and one way or another with new barriers and the exacerbation of existing barriers. These key learnings have effectively contributed to our subsequent evidence-based advocacy efforts. The most common barriers that emerged from both studies included lack of access to COVID-19 information, particularly due to the lack of accessibility of information in different formats: national sign language interpretation, captions, braille, or alternative formats. Lack of employment and social protection, inaccessible healthcare facilities, lack of disability inclusion and response and recovery efforts, lack of available COVID-19 data on persons with disabilities, and the changing role of organizations of persons with disabilities, specifically in where organizations of persons with disabilities stepped in and provided vital information, support, and services to members where governments were not. Some common new barriers that emerged included changing roles in existing family situations, increased competition to gain employment with general overall high unemployment in many places, lack of resources to access COVID-19 information via cell phone, internet, and contributing to an increasing digital divide, and increased lack of security and safety in some countries. These findings and other organizations of persons with disabilities led studies have importantly contributed to evidence-based advocacy. Thank you.
Thank you so much, Mohammed, for these insights and perspectives that are so important to this discussion. Now I'm pleased to turn to Rosanna, that's the Ecuador Country Director of the Plan International. The CSO collaborative report highlights the fact that the official data provide an inadequate picture of communities' experience marginalization in this pandemic. In your view, as an INGO National Director in a country that was hit hard by COVID-19, what are some of the biggest challenges facing CSOs responsive to the pandemic? And what is the responsibility of governments to address these challenges? Rosanna, the floor is yours.
Good morning, and many thanks for the invitation. Is it okay if I speak in Spanish? It is. Okay, so I'll turn to Spanish because oh, Kate says no, I should speak in English. So I should go on in English. It's fine for me. Sorry about that. The first thing that I would like to say that is about Ecuador is that our country was already going on in a very significant, to say the least, economic crisis, social crisis, political crisis. So when the pandemic hit, the situation only got worse, and especially for girls, for boys, for adolescents, which are those most impacts that I would like to highlight. I would like to highlight education. 4.4 million children were at home with no education for, at the moment, 16 months. And another one is food security. It is the first time in Ecuador in many, many years that people send me emails saying, you know, I don't have any money to eat, and we're doing some money here on the street, but it's not enough. But also, I would like to say that the violence, especially for girls, for adolescents, has been a big problem because girls at the moment in time are locked in with aggressors. It is a situation that it's very difficult to inform, but I think this is the time to say it. You know, in at least in the region, in Latin America, the people who abuse girls are the people, usually, mostly the people that are around them, nearby them, in their family, in their neighborhood. So now with the limitations of the pandemic, now the girls are locked in with these people that, and sometimes even their family that abuses them. So that's a huge problem. And of course, I have to say that poverty, unemployment have been very much, a huge problem. And at the moment in time, I would say that the government, the first thing that they have to do is complete vaccination, which in Ecuador was going very, very slow. And it was a huge concern. Now the pace is moving on, and hopefully the population will get vaccinated. But the other huge challenge is that children go back to school. It is starting to open the schools, but not with the rapidness that we would need. We would also need the government to assign enough resources, which are not there. I mean, the government will have to do, quite a few priorities so that food security, employment, education are there for children, but especially, some very particular measures so that children, especially girls, are protected from violence and especially sexual violence. Thank you.
Thank you so much for your contribution. And we see across the region, Rosanna, I'm from Brazil, we have so many challenges on economical level and how states are failed to provide a social network of protection mainly for youth, adolescents and children. So thank you so much. Now, I would love to hear from McDonald, the Director General of the Kenya National Bureau of Statistics. McDonald, please, can you share what Kenya National Bureau of Statistics experience is in working with communities and civil society on data production and its use? and whether these collaborations shaped your response to the COVID-19 pandemic. Thank you so much. Please keep your contribution up to 3 minutes. The floor is yours, McDonald.
Thank you so much, Daniel, for the chance. First, I will, good morning, good afternoon, and good evening to all, wherever you are. I would first commend the organizers of this activity, this event, because it comes at a time when the statistical environment needs adjustment to embrace the emerging issues around the world. Indeed, COVID-19 pandemic affected many data collection efforts by the Bureau of Statistics, and I believe this is something that was experienced all over the world by the national statistical organizations. We have endeavored to deliver statistical products that meet user needs and also try to respond to the changes that occur. However, with the dynamic nature of the data ecosystem, the limited human resource and financial resources, we realize that generating official statistics has not been very easy. And so we collaborate with the civil society and try to harness the citizen-generated data that can be used to fill up the gaps that are being experienced. There are many data gaps, of course, for reporting even for the SDGs, and therefore obtaining granular data for planning and monitoring of the development initiatives at the grassroots level is actually quite crucial. So KNBS really had even started looking at citizen-generated data before COVID-19 struck. I would take a point in 2018, we needed to conduct some surveys that would try to bring out the underground economy, which is made up of a number of activities which also contribute to the economy, but are not captured either in the tax system or the registration system. So having then realized that we needed this, and we wanted to cover the commercial sex workers, because that's one of the groups that I'm referring to. We are not able to have a frame. We didn't have any other information that could help us in this. So we had to engage the organizations that are responsible for the commercial sex workers, so that we could get information that we would use to help creating a frame to allow the conduct of the sample survey. So this actually was successful. And so that is one example where we have worked closely with the civil society. The Bureau has also ensured that non-state actors are actors in the production of data are represented in the statistical technical working groups, which then would look at the various thematic areas of data collection or data generation. It is a process that we conduct. We have quite a number of committees which would identify key stakeholders and bring them on board, so that we meet on a quarterly basis to help us come up with data that we are able to use. So it is not just limited to the government agencies, but we have been bringing on board a number of civil organizations to be part of this process. From the emergence of the COVID-19 pandemic, several lessons were learned on how to obtain data amid the strict measures that are in place to curb the spread of the virus. So key among them was the need to leverage on the technological advancements in the improving the data processes. For example, we employed the use of the computer-assisted telephonic interviews, the CATI, and also the web-based surveys to obtain information from respondents. And this is This was coming at a time that we did not have any clear way of getting the contact for the people to reach, because if you had to reach them through the telephone, then you needed to have the telephone numbers, and this was not very easy for us. But some of these telephone contacts could be obtained from databases for the actually also demonstrates that we have been able to work together as a team to help in data collection, and especially in areas where we have challenges in getting data. Thank you so much, Daniel. Back to you.
Thank you so much for your collaboration and for the amazing investment effort that Kenya National Bureau of Statistics are leading. Now I'm pleased to introduce Landry, that's an environmental activist, peace builder, and Pan-Africanist from Burundi, who is the Africa Regional Director of the 350.org. Landry, as a grassroots peace builder and an activist witnessing that the pandemic has worsened inequalities, can you please share with us and provide us some examples of how local communities have shown resilience and how important it is that we collect data to understand this resilience? Landry, please keep your contribution up to 3 minutes, and we are looking forward to hear from you.
Thank you very much. And yeah, good morning, good afternoon. Hello, everybody. Nice to be here. Yes, there are many ways in which communities have shown resilience during the pandemic. I think where I come from, I've seen communities showing interest in accessing the real information, the real data about the pandemic, and also dismissing all the crazy rumors that were spraying around. I think when the pandemic started hitting, there were a lot of information about it, how it can get transmitted, and how to cure it, what can be done. So the first of all, we see we've seen communities wanting really to know what is about COVID-19, what is about how it can be transmitted, how can prevent it, what can be done about it. Also, we've seen communities developing an early response to the pandemic, thanks to the experience gained from previous diseases in some of the Great Lakes region. We know, in West Africa, for instance, Ebola outbreak back a few years ago has been a very interesting case study. And with the pandemic, then communities use the expertise and experience gained from previous outbreak to respond adequately to the issues that they were confronted with. We've also seen youth and small businesses starting producing homemade masks, for instance, while the government were probably waiting for supply coming from abroad. We see some small businesses, without waiting those external supply, getting started with the production of homemade masks, which we believe is a good example on how the communities use their own resources and what the skills to produce, to put up preventative measures without necessarily counting on external supplies. And we also seen from, I think, a cultural and social perspective, the reactivation of those solidarity spirit and channels, especially to help the most affected and vulnerable categories, starting with the elders and those who have been hard hit by the pandemic. I think those are some of the example where communities in Burundi and the Great Lakes region have responded. At the same time, I will add that there has been, and I think there is still at the moment, gaps in data on how the virus has impacted African citizens. There are not so many studies or research about it. I'll just quote one of the study that was conducted last year between April and August, and that was commissioned by the World Bank, which which wanted to know the impact of the pandemic on the employment, on food security, health, and other key sectors. For instance, it's revealed that the majority of the people in the sub-Saharan continent have been generally less susceptible to losing their jobs, whether they are in formal or informal kind of sectors, except in East Asia. In the eastern part of Africa, and also the same figures show that household in some sub-Saharan countries reported being food insecure across multiple dimensions. In South Sudan, for instance, 72% of households reported going an entire day without eating in the last 30 days due to lack of resources. In Nigeria, 3 in 4 households also reported skipping a meal in the previous 30 days due to lack of money. I think those are just examples on how data collection is incredibly needed to be able to formulate response strategies that are based on evidence. Thank you.
Thank you, Landry, for those valuable insights from your grassroots perspective and how people across your region are facing and stand up to fulfill the gaps left by formal institutions and creating the change they need. And we are here also to support them and to keep moving on this dialogue. And that's the reason why I would like to go back to Rida now. I would like to bring you here too. Rida is an activist from Saktikira in Bangladesh. And from my own experience, I know that community-owned responses have often addressed the gaps and bias of official COVID-19 responses. How did your own community respond to the pandemic? And what do you think needs to be done to nurture your community's resilience now recovering from the pandemic? Landry, the floor is yours. Please keep your contribution up to 3 minutes.
Thank you so much. Can you hear me?
Yes, Rida.
Thank you. People who have been marginalized have made critical contributions to the COVID-19 responses, like providing practical support to families, friends, and peers, providing mutual financial aid, and translating or sharing official information. People who have been marginalized have also demonstrated extraordinary resilience, adapting to the effects of the pandemic by finding new sources of income and resolving food insecurity. The young people here in my community collected citizen-generated data and assessed what was needed for the community. Then the young people analyzed the data they collected from the field and generated report and shared the findings of the report with different stakeholders, local governments, elected representatives, local media, and with the community people. I am living in one of the remotest part of the country here. At the very beginning, people are not aware about COVID-19 virus and the information on how it infects people. People at the time, even at the time, government did not take massive initiative to raise awareness among the people. Young people of the community prepared posters, flyers, miking in the area where government did not take action. Young people of my community also had advocacy with the local governments for social protections and food support for the disadvantaged and vulnerable people. Young people also opened information center in the community where any people could come and know about the information related COVID-19 and its related public services. Due to lack of announcement and necessary initiative of the government to register people for vaccination program, local people of my area are not able to register for and take the vaccine. Young people of my community had massive campaigns and registered the information of the people whose age came under the coverage of the vaccination program. People who have marginalized or at risk of marginalization have demonstrated extraordinary resilience during the COVID-19 pandemic. From diversifying sources of income and increasing entrepreneurship to supporting each other financially and through practical initiatives such as food distribution, people who have been marginalized have been And far from passive actors during the crisis, many have been agents of change, addressing challenges and driving solutions that meet their own and their community's needs. Thank you.
Thank you, Rida. Now we can see you. So thank you so much for turning on your camera so we can see you. And thank you so much for your valuable insights from youth actions and community responses. I'm pleased now to introduce, at last but not least, Natasha. That's the Global Youth Advisor at the Danish Ministry of Foreign Affairs. I'd like to ask you, Natasha, what is Denmark's approach to fostering collaboration between governments, communities, and civil society organizations to build more inclusive and equitable societies? And how did this approach influence engagement with the stakeholders during the pandemic? I would also ask you to keep in mind that to keep your contribution up to 3 minutes, and as we have simultaneous translations and interpretation for international sign of language, to speak, to mind your pace when speaking, so we can provide the translations to the other language and to the sign language. Thank you so much. The floor is yours.
Thank you so much, Daniel, and I will definitely keep in mind the time and also remember to speak clearly and slowly for the interpretation. First of all, thank you so much for inviting me and Denmark to be part of this panel, and I'm very honored to be part of this panel with the other panelists contributing with so many different but yet also very important perspectives and the work going on. I'm very excited to provide input and remarks on how we in Denmark and as Denmark work with civil society and stakeholder engagement. Whether we talk UN processes or our national processes, one thing is quite clear to us, and that is the fact that we are fully aware that we need the inclusion and meaningful participation of all stakeholders to achieve our common goal of a sustainable and peaceful world. Denmark recognizes and fully supports the important role that civil society plays in achieving the Sustainable Development Goals, and also in terms of the principle of leaving no one behind. We need to promote, protect, and allow civil society to participate because we know it makes a difference. Inclusive processes ensures better outcomes. Ensuring the inclusion of civil society, quite simply, is key. It is an agenda that Denmark is very committed to, and we are continuously engaging with the UN, with member states, and with civil society to not only keep this agenda at the forefront, but to actually advance and push for development. This year, Denmark is presenting our second VNR, and at the same time, we also chose to do or to develop a national action plan for the SDGs in order to have a national and international review built on each other. The second Danish VNR, and when I say VNR, I mean Voluntary National Review, which is a report to the UN on our implementation of the Sustainable Development Goals. This second time around, our process has been much more collaborative and inclusive. It is not just the government's report, it is also the report of civil society and stakeholders across the board. That is also why in our report you can find civil society opinions and assessments directly in the report. They are not annexes, they are actually concrete and specific parts of the process, and they're also unedited, which is a very it's quite a clear picture of how we have also approached the processes to actually open up and include civil society and other stakeholders from the very beginning. We know that we cannot achieve the SDGs and the 2030 agenda if we do not engage all parts of civil society. That is also relevant in COVID-19 response and recovery as well. Governments have a big, and our government have a big role to play, and we have the main responsibility, but without civil society, civil engagement, the private sector, academia, you name it, we will never get all the way and we will never reach the finish line. So we need to find solutions together and make it a joint venture to implement them also at national level. Just to highlight also a good practice on our side, I mean, the Danish delegation to this year's high-level political forum, HLPF, consists of more than 50% of civil society and youth delegates. We share speaking time at high-level events whenever we can. We also hold a seat for civil society in negotiations, especially in terms of the ministerial declaration. So we look at the structure, we look at the processes, and then we look, okay, where can we actually take responsibility and try to open doors? So just to summarize and stay hopefully within my speaking time, 2 principles have been and will be key in our approach to stakeholder engagement. Leaving no one behind, being the core at what we do. And then the second one, which is a translation of a Danish saying, but that is ownership creates change, which basically means that if we don't include, if we just do it by ourselves, then we don't really create the sustainable change and impact that we want to. So thank you.
Thank you, Natasha, for this inspiring and amazing contribution from the Danish perspective. And thank you all of the panelists for your really insightful and interesting perspective on COVID-19 inequities, data, and community resilience. Lily Paul is going to take over the panel moderation as we turn now to looking ahead. Lily Paul, the floor is yours.
All right, thanks, Daniel. That was such an interesting discussion, and I'm looking forward to hearing what the panelists think comes next and how we can actually progress more inclusive participatory data systems and decision making. So Landry, as you highlighted, the pandemic has been emphasized. The pandemic has emphasized the critical role of local organizations to support communities and tackle injustices. So as we reflect on the recommendations of the report, what do you think are the most important points to help drive inclusive and equitable progress?
Thank you very much. Hope you can hear me well.
Yes,
okay, great. Yeah, sure.
You.
Thanks for the question. I think the pandemic again has the experience showed how grassroots organizations are the first key player in the social and economic response strategies that have been developed or in response to COVID. I think the expertise in analyzing local situations, understanding the dynamics, and knowing what are the real needs for the people, including people with disability, have really made them I would say the right expert in the response strategies. And of course, this is in collaboration with other key actors, whether it's the government or the health sector and international organizations that are helping in addressing the pandemic. So if we are to set up inclusive and equitable processes, we must ensure that the experiences and expertise of local communities, civil society groups, faith-based organizations inform the robust strategies that are response strategies. So we're basically advocating for the inclusion and active participation of such group in those processes. I think what they need primarily at the moment is recognition. First of all, let's acknowledge the important role they've played and they continue to play up to now. And they also need platform where they can share and express like the experiences, platform like this. And again, thank you really for providing this platform so we can actually learn and get those insights and experiences for the wider civil society movement. They also need technical and financial resources to keep going, doing the good job that they do. It's good to be recognized. It's good to have the platform where people can express their and share their views, but also at a practical level, they need resources that can enable them to develop, if not like triple the good work they're doing. So at the end, I would say that local communities and civil society groups with proven record should be at the center of the pandemic response strategies and partnership, thanks to their proximity with the beneficiaries, the knowledge of local contexts and realities, the flexibility, and also their great capacity to deliver in a timely manner. Thank you.
Yeah, all right. Thank you so much, Landry. I will move straight to McDonald. McDonald, the recommendations call on NSOs to more actively partner with communities, nurture community and CSO data production, and also improve the inclusivity of official data systems. So what are KNBS's future plans and commitments on these topics? Yes, please. We're able to get to you.
Okay. So yeah, early this year, we launched the Kenya Strategy for Development of Statistics, which covers the years 2019-2020 up to 2022-23. And it provides for the plan for statistics for the wider data ecosystem in the country. This plan, which is actually a master plan, incorporates the strategies contained in the Kenya National Bureau of Statistics strategic plan that recognizes the use of alternative sources of data, such as the citizen-generated data, together with the big data, to fill the existing data gaps that are noted from the official statistics side. To guarantee quality and reliability of data sourced from the CGD and the big data, a framework of quality assessment, quality assurance is actually being put in place so that we are able really to check on that bit of the quality. And the framework, this framework actually is going to include the Kenya Statistical Quality Assurance Framework, the KESCAP, what we call the KESCAP, and it is, and the Bureau intends to launch it before the end of the year. So this program, this framework would actually assist us in looking at the quality of data that is actually generated, coming from the citizen-generated data and the big data. So KNBS has also drafted a work plan that is meant to operationalize the CGD data quality criteria, which has actually been technically supported by the Paris 21. And among the prioritized activities is the work plan. That is that gives the among the prioritized activities is the work plan, and it also looks at the incorporating of this the civil society organizations, because this is where a lot of the citizen-generated data comes from. And the work plan also focuses on the sensitization on the CDG quality data quality criteria and its application on some of the data that exists from the CSOs. So the Bureau of Statistics is actually already working with the Global Partnership for Sustainable Development data, that is the GPS-DD, in achieving this goal. So the process is on, and we are actually collaborating very well. Now, as I mentioned earlier in my earlier discussion, the Bureau has ensured that non-state actors are really involved in the statistical processes through the involvement of this, their involvement in statistical technical working committees, which we normally run on a quarterly basis. And I also wish to mention that, like in our Gender Technical Working Statistics Committee, then the Disability Technical Working Committee, Governance Technical Committee, all of them are having the involvement of the civil society organizations playing active role as members of this, so that we look at what the kind of data that generate, we try to help them get to use the standards that we have in the process of generating the statistics that is coming from their end. That will then make it easier for us to authenticate the same as official statistics, because our act, our Statistics Act provides us for the chance. Okay, thank you. I'm just about to finish. So it is also worth noting that the CGD, harnessing CGD for official reporting is actually a bold step taken by the government to ensure that we have data for use. It will also be great to, it will also be a great milestone towards modernizing the data ecosystem in which the production of statistics is user focused. I wish to indicate that the civil society that to the civil society that KNBS is always open, willing and ready to collaborate with you to strengthen the quality of data in the country. So as I finalize, I'm also proud to, I'm really proud to in our achievements, and appreciate the support that we are getting from the GPS DD, the Paris 21, the UN Women, and the GIZ in this process that we are discussing here. We also welcome partners who really are willing to be part of this journey as we ensure that we provide enough information to inform our decision making. Thank you so much.
All right. You went a little overboard, so we admonish that we stick to the time so that we can close on time too. So Rosanna, over to you. I'm keen to bring you in here as the recommendations not only call governments to action, but also emphasize opportunities for civil society to evolve and deepen their ways of working. So what do you think the role of INGOs is in supporting governments and communities to collaborate more closely on data production and use?
Thank you. I think the role of INGOs at the moment in time is very important, and we can play quite a few roles. One, and we've done some as Plan International in Ecuador, is to articulate sectors, like bring together communities with local authorities. And in such a way, information and data is going to flow from one side to the other, but also with the private sector. So we have triangled the government, the private sector, the INGOs, the communities, for example, to bring food, to bring support, to bring internet to the communities. That's another role that we could play. But also another one is to influence the government so that certain priorities take over another ones. Another one, which is even more important, is to strengthen civil society organization, local movements. We've been supporting a few young people movements, like a girls movement, like a network of young people that are working for their rights. I think that's quite important. Another one that we have played is transforming all our programs into digital, so that through different platforms we're able to keep working with children, with young people, and of course engage them, because they really like to be, on digital. And in such a way, we also continue helping them to develop or strengthen their abilities. Another one that I would like to say is that we also need to work together, together with the other organizations, always like another partner, and especially bring the voices of children, especially girls, to authorities, to the public, in such a way that whatever their concerns are and their proposals and actions are, they can be heard and get a response. Thank you.
All right. Thank you very much. I would also move now to Eurida or Eurida, and I would love. Okay, so while we wait for Eurida, I think we'll go to Natasha. Natasha, if you're available, let's just do this. So the report calls for more participatory and inclusive decision-making processes, as well as enhanced support for community and CSOs, CSO data. In what ways will the Danish government support this agenda with civil society?
Thank you so much, Lily Pearl. I think to first and foremost highlight from Denmark, I mean, we continue to do what we can to include civil society in the processes on our part. As I already mentioned, by giving chairs to civil society as part of the negotiations. We did it during the Commission Status of Women. We are doing it during this year's HLPF. So on that part, we will definitely continue, because we also know that it shows best practice approach and will hopefully inspire other countries to do the same. Looking at our own processes when it comes to the VNR, the National Action Plan, and even the development of our new development cooperation strategy, it has been underlined again and again that cooperation is crucial with stakeholders. The importance of knowledge, exchange of ideas, experience, best practices, and valuable recommendations cannot be stressed enough. This is both relevant in terms of input for policy initiatives, but it's also relevant in terms of exchange of knowledge across the different sectors, across the different pillars. Involvement at an early stage is key. We've learned that for sure. And in our case, meetings, hearings, conferences have provided platforms for necessary exchange and increased awareness in what we do, and also bringing aboard civil society and stakeholders. And I think to highlight also, I mean, we are fully aware that we have a responsibility to also do better. I mean, yes, we have best practices, but we also still have quite a long way to go, especially when you look at, for example, leaving no one behind and reaching, vulnerable and marginalized groups. Also coming from my own experience, Global Youth Advisor, youth advocacy, we have to say nothing about us without us. And I think that is a very, very important principle to keep in mind also as a government when talking about vulnerable and marginalized groups, because we do not know who we are leaving behind if we don't ask. And we don't know how to reach those furthest behind if we don't know who they are. And I think that has been a very, very clear example of where we can and should improve in our processes when it comes to involving stakeholders. And just to finish off, I mean, what I've highlighted in terms of what we're already doing, we will continue to do so. We are very much looking forward to following up, especially on our voluntary national review in terms of implementation, monitoring, evaluation with civil society and other key stakeholders. So thank you so much.
Oh, thank you so much, Natasha. That's very insightful. And I love the part where you say that if we don't know who, how do we drag them along? That's very, very worthy to note. But I don't know if Ureda is available now. All right, if she's not available, I'll just move straight to, Ureda, is that you? Okay, I'll just move straight to Mohammed. So Mohammed, the report recommendations outline the foundations for more inclusive and participatory approach to data and decision making. So which aspects of the recommendations would you most want to see actioned and why?
Thank you very much for this great question. All of the recommendations are important for us. Persons with disabilities and their representative organizations are the experts on the issues that are affecting them, and thus need to be actively involved in partnerships, influence inclusive decision-making processes, be meaningfully involved in all stages of policies and programs, and be part of inclusive data efforts. Specifically, persons with disabilities and their representative organizations need to be meaningfully included in the planning, implementation, and monitoring of the Convention on the Rights of Persons with Disabilities, the Sustainable Development Goals, and in COVID-19 and other emergency response and recovery efforts. It is not enough to be involved to be invited to the table, but there also must be meaningful engagement and consultation with organizations of persons with disabilities at all stages of the design, budgeting, implementation, and monitoring of policies and programs. Furthermore, persons with disabilities and their organizations need to be part of data collection efforts and processes. In fact, organizations of persons with disabilities are generating community-driven data around the world that provide an important piece of the story. There need to be more support and capacity building for organizations of persons with disabilities to gather community-driven data to complement traditional data sources and highlight information that cannot be captured in other ways. Additionally, organizations of persons with disabilities community-driven data need to be recognized by official statisticians to fill gaps where no data on persons with disabilities exist. This can help to identify and address the many barriers that persons with disabilities face on a daily basis. Finally, it is imperative to bring together statisticians, policymakers, organizations of persons with disabilities, and other stakeholders to exchange information, learn from one another, and create evidence-based policies to create sustainable change. Thank you very much.
Oh, thank you very much, Mohammed. That was very insightful delivery. And the fact that CSOs and other agencies need to come together to have a collaborative effort towards persons with disability. All right, I hear Uraida is back online. You're welcome, Uraida. And so I was saying that I'd love to know your thoughts on what you think are the most important factors that need to be addressed to enable communities to be able to truly engage in these collaborations. And we are far behind time, so we'll appreciate it if you could summarize this within 2 to 3 minutes. And we'd love to see you though, so kindly turn on your camera.
Thank you. Sorry for this. The network connection is not so good. So if I turn on the camera, I'll disconnect it. Sorry.
No problem.
So from our community experience, we have noticed that some of the factors we genuinely need to be addressed to enable community people to be able to truly engage in the civil society, government, and community people collaboration for influencing more inclusive and equitable outcomes. What we need is coordinated action to ensure people who have been marginalized are part of the health response to halt the health impact of COVID-19. Coordinated action is also needed to address the social economic consequences of the pandemic in a way that works toward an equitable recovery, strengthens social protection measured based upon an analysis of the economic impact of the pandemic on people who have been marginalized, and economic recovery plans to be based upon the principle of leave no one behind. Provide clear guidance for identifying learning gaps as a result of the pandemic and to ensure curricular teaching strategies and individual education plans work to choose the learning gaps that exist. Last but not the least, one approach may not fit all situations. A context-specific differential approach and fully resourced CSO as well as community engagement plan for COVID-19 response program must be defined based on an assessment of the local situation and specific objectives linked to results and accountability. Thank you.
All right, thank you so much. And I'm very happy that you were able to come back in time just to respond to this. And we are very excited that this discussion has come to an end. We will quickly move on to the part where we have our Q&A with the panelists using audience questions. So we will go to the questions now. Daniel, are you available?
Yes, thank you
All
so
right.
much, Lily Bo. What a brilliant discussion that you guys just had. I know that there have been a lot of questions in the chat box and the Q&A function on the chat that you guys can find on the bottom of your screen. And I will try to share some of those and try to get through as many as possible in the time we have available. I would very kindly to ask the panelists to keep the answers up to 2 minutes so we have the chance to go through the audience questions. The first question is directed to Natasha from the government of the Danish government, who has demonstrated a good practice when it comes to inclusion. Does the government collaborate with counterparts to exchange learning and promote inclusion? Natasha, could you please elaborate a little bit more on that, on the collaboration with counterparts and to exchange learnings and promote inclusion?
Yes, thank you so much, Daniel. In terms of counterparts, I'm gonna make my understanding that it's other member states and talk from that perspective. So I think from our perspective and in our practice, what we know is that, you know, when we do policy processes, when we do diplomacy, and when we work for development, we attend a lot of meetings. It's a lot of talking, it's a lot of discussion. But a key aspect in our work is that we also need to walk the talk, and we actually need to put action behind our words. And that is also one thing we know that can be used to inspire and influence other member states. Obviously, if we have a topic that's very important to us, for example, the meaningful participation of young people in policy processes, which is a key priority for Denmark in our development work. Well, then we know that if we push for change, if we take on responsibility, if we contribute with ideas, solutions, then we are also and engage in dialogue and discussion with other member states, also and especially member states that do not necessarily look like us or have the same societal structure as us. Well, we know that in the room for dialogue, in the space for discussion, that is also where we can inspire other member states to follow suit or even create their own progress in terms of specific topics. So, I mean, I think to summarize this, it's about walking the talk. If we fully believe that what we're doing is the right way to approach a topic, if we're pushing for change, and not only pushing for change, but also implementing change and creating impact, well, that is one very clear way on how to actually get other member states to follow and do the same. So that very short from my side.
Thank you so much for elaborating these and providing valuable insights for your experience as a youth advisor and expert from the Danish government. Now, Landry, I would love to invite you to this discussion, since we have questions about asking if you have any successful intergenerational approach that have happened during the pandemic and that has increased the resilience of communities. So I would ask you to present a 2 minutes contribution to that questions about intergenerational programs and projects that were successful. And then I would love to hear from Vapu to elaborate more on that from your perspective. So Landry, the floor is yours.
Yeah, thank you again. I think there are quite a number of experiences and approaches where we've seen intergeneration approach and solidarity happening. And I would say that in most of, like, the African context, such experiences happened like organically. So let's say the younger people, family members, they feel the necessity or the responsibility to assist those in need. So such kind of experiences may not be well documented, but I'm sure, like across the region, we've seen individuals or small groups, youth organizations taking initiative to support and help the most vulnerable groups, because it's also part of the culture. It's a cultural thing to assist the elders and ensure that they feel safe, they feel supported, they have someone to talk to, and their needs are known, and they can also be referred to those in position to offer, can I say, maybe a more complex solutions, if it's like linking the sick one to the hospitals, or ensuring that they've got the right medication. So we've seen such examples happening, and I think these are very good examples of humanity and the Ubuntu part in us. I am because you are. If I see you suffering, I feel compelled to do it, to come out and help. I think this is a brand example that could be, I think, could spread across the world, to know and to be prompt to assist those who are in necessity.
Thank you so much, Lendra. Yes, we are on this together, and we can help each other. Vapu, I would love to hear from your perspectives and experiences in intergenerational programs and projects during the pandemic. The floor is yours.
Well, thank you. So intergenerational help and support, this happens organically, like in Africa as well. And it happens from grandfathers and mothers to the grandchildren. They support mentally, of course, but even financially nowadays. And but just now we are discussing quite much our NGO world. How should we support it? Who should do it? And we can see that the world has been changed. So young people, they are not so interested to do a persistent NGO work, but pop-up activities. And of course, this COVID situation have given a very good opportunity to inspire and innovate some activities between young people and older people. My generation, of course, we are committed 20 years, 30 years, 60 years for our NGO work, but this is not the case anymore. But our government supports our NGOs, and politics can't work without a dialogue with NGOs intergenerationally. And I have been very pleased to listen to all these discussions here, because it's a great variety of people, so-called marginalized people, how they raise up and show their voice and importance. Thank you so much.
Thank you, Vapu, for bringing your perspective to the table and sharing with us. And also thank you, Landry. Unfortunately, we're running out of time, but I do encourage you to write down in the chat your questions and ideas and insights you may have, and we definitely can share that with the panelists. So in the near future on our publications and social media, we can provide responses and also content related to your questions from all across the globe. Time is running out, but we want to end this event by saying thank you very, very much to all the individuals, communities, and activists who contributed their time, efforts, and brainpower to generating data, contributing to research and leading responsive efforts. Without you, this reporting conversation would not be possible. We encourage you to go and explore the report online and keep engaged with the hashtag, the Unequal Pandemic.
Yes, don't forget the hashtag. And thank you so much. At this point, I would want us all to turn on our cameras just so we can see everybody before we run away. And we know this is just the start of the conversation, and we look forward to continuing it with you. Please do read, contribute, and follow along with the hashtag Unequal Pandemic. Special thanks to the CSOs who conveyed this collaboration and event today. Thank you all. Can I see you all turn on your cameras, please, before we run away? Kindly turn on your cameras, quick. Let's see each other before we go. All right, thank you. All right, thank you. Yes, thank you. Hi, Elizabeth, captioner.
Thank
Can
you
we
very
see
much.
you? All right, thank you. Bye.
Thanks, everyone. Bye.
Please do visit the chat box also. There's some information over there. And don't forget the hashtags as well. All right, bye-bye.